Welcome to Module 6 of the NHS Insights programme, which is providing an introduction to co-design and user-centred thinking. The learning outcomes of this module are to enable participants to understand how co-design and user-centred research can help when tackling specific healthcare challenges. It also helps to explain the value of including lived experience from different perspectives by including patients, caregivers, and clinical staff in the innovation process, with the aim of creating solutions which are truly relevant, usable, and accepted. Finally, this module gives participants an understanding of why PPIE, that's patient and public involvement and engagement, is essential in developing innovation and the adoption of innovation. So this webinar is one of a series of training modules in the NHS Insights programme. The aim of these different modules is to develop a culture of innovation, improve innovation-related knowledge, and empower all staff to be innovation aware and ready. The Insights programme has clear aims to help explore, discover, and evaluate innovations which can make a real difference. So the previous module, Module 5, covered the importance of validating needs and developing a problem statement when faced with challenges. This module looks at the importance of co-design and user-centred thinking when seeking to identify or develop solutions to these challenges. So co-design requires user research, and that means that it's important to identify all the key stakeholders and determine what their actual needs are, rather than their assumed needs. And to conduct this via interviews or focus groups. Another method might be to observe the users with their existing device, technology, whatever it is, observe their interaction with comparable products to see what challenges they're facing. So who might these users and stakeholders be? Well, it could involve clinical staff, and of course, there are different types of clinical staff, so that might involve consultants, it might be nursing staff. How do their needs differ? It might also include maintenance staff, because after all, they're the ones that may be having to clean or assemble a new device. They might be the ones responsible for installing it in the first place. Other stakeholders to consider include patients. And then you need to think, what age are they? Are they children? Are they elderly? What level of dexterity do they have? And then carers as well. Similarly, they could be elderly, they could be children. What level of mobility and dexterity do they have? So I have an example here of how different stakeholders might interact with exactly the same device. Because you might find that nurses, consultants, patients, and biomedical engineers all have different levels of interaction in some of these key tasks. So for example, for a nurse, if this is a product where they need to review dosage in the last 24 hours, they might be doing that several times a day. For this type of product, they might also need to set up a bolus infusion every 4 hours, again, doing that several times a day. But in terms of assembling it or calibrating it or servicing the device, that's not an activity that they would get involved in. Now, a consultant might have different needs and interactions with that same product. So again, they might have daily interactions with reviewing dosage, but they may only occasionally need to set up a device and give a bolus infusion every few hours. Similarly, as with nurses, they may never be involved in the assembly or calibration of that device. Patients, on the other hand, might have completely different needs. So whilst they may be interested in looking at their dosage over the last 24 hours, they won't be involved in setting up the device to allow a bolus infusion, neither will they be involved in calibration or servicing products. Biomedical engineers, on the other hand, they will never be looking at the dosage, they'll never be setting it up, but they'll be frequently involved in assembly, calibration, and servicing that device. So this is just a quick example to underline how it's important to involve all stakeholders in the process of exploring what the challenges are with existing devices and what their needs are for new devices. So how can we get that sort of feedback? Well, there are different methods of getting feedback, and I'll go through each of them in turn, but it could be interviews, it could be in focus groups, it could be by issuing surveys and questionnaires, and it could be by observation. The purpose of all of these is to get insight that you can't easily get just from research. Just by doing basic research into literature, it's quite challenging to get some of this insight, hence the need for conducting this primary research. It's also an opportunity to get to other things, to get facts about a new innovation or about a challenge that they're having, but also their opinions as well, because both are valid. And it's also an opportunity to validate some assumptions. So the first method is interviews. So this is an optimal method for getting really good insight. It's an opportunity for getting both fact and opinion, to validate assumptions as well. Although it can be challenging to get people to agree or to get a sufficient number of participants to take part in interviews. Additionally, it can also be time consuming if you're looking to interview maybe 6 to 8 different people, different stakeholders. It takes time to conduct those interviews and also to analyse their responses. One final thing to notice is that if you're wanting the opinion of some key opinion leaders, it's conceivable that they may not do it for free. They may want to charge for their time and expertise. So another method of getting this sort of insight is through focus groups. So clearly getting people together at the same time in the same room, that can be more challenging to arrange. It also possibly introduces some bias as well. So depending on the people, the makeup of that group, maybe you have some senior people and some more junior people, or maybe you just have some very strong personalities in that focus group. You can introduce some bias where perhaps the opinions of some is not as easily expressed. But focus groups are an ideal opportunity for peer-to-peer feedback from learning and bouncing ideas off of other people. And also, once again, just one word, it's conceivable that some participants may request some payment for their time and expertise. Another way of getting feedback is through surveys and questionnaires. The difficulty with these are that you may not get the sort of engagement and response rates that you're looking for. So you can potentially provide an inducement for completing the questionnaires, but the response rates are the key challenge in this. And then you need to be careful with the questions that you ask. If you're asking questions that give a qualitative response rather than quantitative, then it's potentially more challenging to analyse the responses that you get. If you're asking people to rank things out of 10, then it's relatively easy when you've got numbers there. But if you're asking for opinions and feedback, to analyse those qualitative responses is more challenging. And of course, with surveys and questionnaires, there's limited to no opportunity for getting some clarification. So people might write some interesting responses that you want to delve a bit deeper in, but then it's more challenging to get that additional depth. So another great way of getting feedback about how people interact in their current pathway or with particular devices or with different ways of working is to observe them. So this is a great method of getting direct feedback on the current workflow, on maybe competing products or design iterations, different prototypes, different versions of a new product, or indeed products that are suboptimal and you're looking to understand why they're suboptimal. So these are ideal opportunities for assessing how easy something is to use. And clearly you could conduct these via Zoom, via Teams, but ideally you want to do them face to face and also ideally record them as well, because sometimes you can pick up interactions in the recording that you don't necessarily observe during that live session. So that's different ways of getting the insight that you might want from your different stakeholders. But one important thing to cover is the variety of stakeholders, and this involves PPIE. PPIE is patient and public involvement and engagement. So that means developing products that work with and for patients and communities. And that also means working with them right from the outset. So if you're developing a new product, get their opinions, get their views included right from the outset in the very early stages of understanding what the challenges are, so that you end up developing a product that meets those needs rather than thinking about their needs towards the end. So this PPIE activity, it combines two things. It combines their involvement, so getting their opinions to help shape design decisions and priorities what's important for different user groups, as well as engagement to enable you to communicate your findings in the work that you're conducting, and also an opportunity to build trust with the user groups that you're working with. So by conducting PPIE early and throughout the design phase, it ensures that your technology is going to address real world needs. And it also means that the interventions that are developed, they're going to be easier to adopt, they're going to be more equitable, and they're going to provide some credibility to regulators, to people that are procuring and people that are funding the different projects and the different innovations that you're looking to introduce. So in health technology, PPIE enables co-creation of tools that are clinically credible, user trusted, and adoption ready. So why is PPIE important? Well, it embeds living experience of patients into the design of your product. It adds relevance, it improves recruitment, retention, and credibility, and it also fosters the idea that research is being conducted with people, not on people. How can you get them involved? Well, there are different ways. There are different advisory groups. You could engage through co-design workshops. You could have community consultations, and you can engage them digitally as well. And some of the challenges and best practices involved, it's important to avoid tokenism. Try to have balanced representation, so ensure that there is some diversity, but don't overburden different sectors of the community. Offer training, offer feedback, and potentially offer some fair compensation as well. If they're contributing to the design process, the innovation process, then it's only fair to compensate them as well. And really do involve them from day one, getting their views and feedback from the early stages of any introduction of any new innovation, or the development of any new innovation is so key to ensure that their needs are met. And just a quick word about young people. Who better is there to advise on the design and functionality of a digital tool that's aimed at young people than young people themselves? So important to consider the age of the people that you're involving if your product is aimed at a particular age group. So how do you find patients to get involved? Well, there are different ways of getting in touch with PPIE groups. So first step is think local. So many NHS organisations have developed their own PPI groups and panels. So explore within your own trust, your own network, to see what PPI organisations and initiatives have been set up. There are also some other organisations as well. So here in the East of England, there's the East of England Citizens Senate. Then across the country, there are also young people's advisory groups, a group called Generation R. And then once again in Cambridge, with the development of the new children's hospital, they're setting up a Cambridge Children's Network as well. So consider what's available locally at your trust, and then do explore other opportunities for engagement as well. PPIE is a great way of tackling health inequalities as well. And these health inequalities and inequities, they might arise from a number of different areas. So it could be income, it could be race, it could be geography, it could be access to technology, it could be literacy, all sorts of different bias. And by ignoring that, you risk having a poor design. You risk having a design that doesn't cater to all sectors of the community. The last thing you want to be doing is excluding sectors that you're trying to attract. So PPIE corrects this by bringing in marginalised voices to the table, getting their views, getting their insight in what's important, and it helps to highlight hidden or contextual barriers as well. So just some examples of that. For example, if you're developing something in the asthma space for asthma research, important to consider urban minorities, because clearly in urban areas, air quality is worse than perhaps in more rural areas. Similarly, in cancer screening campaigns, there are different preconceptions and mistrust in certain healthcare groups among certain groups. So again, important to to get the views and feedback of all members of society and community when trying to develop these campaigns so that you can attract as many people as possible. And just to underline that embedding PPIE early, it ensures that innovations serve the full population, not just the majority. So some other things to consider when conducting design maybe of new products is very much to consider demographics, gender and ethnicity. So important to consider, for example, skin tone. So in the some innovations that were developed in the COVID area that were looking at pulse oximeters, they forgot to include members of society with different skin tones as well. So was report published that the importance of including all members of society when developing pulse oximeters, so that all sectors are covered, and you can record blood saturation levels in everybody, no matter the colour of their skin. Also important to consider that people come in all different shapes and sizes. So if, for example, if you're developing a product that's meant to be used in one hand, consider that not everybody necessarily has a male-sized hand, that there are other people within society that may not be able to operate that device with one hand if they have smaller hands. So again, develop products for all of society, not just one sector. Also consider whether, of course, people are left and right-handed. So what you've developed for use with right-handed people may not be equally applicable for those that want to use their left hand. And then other things to consider as well. So consider vision and vision deficiencies, particularly colour vision. If you've got some particular indicators or switches or LEDs that are red and green, consider that not everyone can necessarily tell the difference. And consider other things as well. So do your user groups, do they maybe have dexterity issues with arthritis or other disabilities? So in terms of designing for different community segments, it's important to be inclusive. So consider different language needs, that not everybody has English as a first language. So consider developing instructions for use and guidelines and so on in different languages. Consider that some people may want to have maybe training opportunities in person, whereas others are happy with digital approaches. Similarly, some people are happy to have maybe some instruction via a video, whereas others would prefer more hands-on instruction. And consider different cultural sensitivities and representation as well. And then try to look at everything through an equity lens, so that some problem statements include and acknowledge different disparities in societies, and don't just design things for the majority. Consider those on the margins as well, and what their needs and requirements might be. And then if you do all that, you end up with PPI-driven systems, which are more sustainable, acceptable, and equitable for all members of society. So one thing to conduct when developing new products or introducing new products is to assess how easy they are to use. And one good way of doing that is to conduct some usability tests, which involves observing them while they perform specific tasks with a new device or with a new product. So again, you want to include all the representative users, so all the key stakeholders, whether that's nurses, consultants, maintenance people, carers, patients. Include all of those user groups in some usability tests, so that you can understand how they interact with the product and get some good feedback on how easy it is to use. And you can do that by setting up some realistic task-based scenarios that help them to use and test a product in real scenarios. Because usability tests can then help to identify the strengths and weaknesses of different design iterations or different versions of different prototypes, different comparable devices. So, for example, on the left and on the right, you can see a feedback from users on the left-hand side might have said, Well, it's not clear when I've clicked on Storms, so having a blue tick button is helpful. Having a progress bar at the top helps me work out how far I am through this process. And having a continue button on the bottom makes it more obvious of how to proceed with the usage of this particular digital product. And you only get this sort of feedback by engaging with users that are those key users, those key stakeholders that are going to be using the product. So we have a case study, have an example here of when a product has been co-designed with the members of society that you're looking to engage. So this was for a diabetes self-management tool. So clearly diabetes is a large problem, a big chronic disease, 4.3 million in the UK living with diabetes, and self-management is inconsistent. And there's particularly low engagement with some ethnic minority groups and in certain deprived areas. So it was a study here to involve patients in co-design workshops so that the self-management tool could consider their views and some of the challenges they might be facing with existing products. So the patients that were recruited, they had a diverse representation in terms of age and ethnicity, and as well as digital literacy. And that helped to shape the product accordingly. And then the impact of that, there was a 30% increase in people logging their daily glucose levels. There was an increase in confidence. There was a reduction in unplanned visits to the GP. And in terms of inequalities, there was a higher uptake in the most deprived quintile. And then the process of developing this way helped to align with current NHS and ICB priorities. So it supported the Core 20+5 initiative, and it also aligns with the NHS 10-year plan by empowering self-care and reducing pressure on primary care. So just a quick example of how important PPIE is in development of a digital product, and some really good outcomes. So with people logging their glucose levels and 18% reduction in GP visits. So that brings us to an end of this particular module. There are some references there for understanding more about how to engage patients in the design of products. Thank you for watching this webinar. If you'd like to get further involved, then you can find out more about the NHS Insights Programme from that web link. And you can also, of course, contact your local innovation team and innovation leads in your own organisation, hospital trust or ICB, where appropriate. Thank you for your time.